features health and medicine, an important and popular field. Today, you will be hearing from a diverse panel of alumni in this field and will be able to ask some questions. Before we get started with the panel, I'd like to introduce our UCR Health Professions Advising Center Director, Charlie Scruggs, who will be providing some opening remarks. Charlie, you may start sharing your screen.
All right. Thank you, Emily. Thank you, Student Alumni Association, for having me. I always think this is a great event, and especially this year due to COVID. I know building an online event like this is not easy. So thank you again for all your hard work. This is much appreciated, and I know our students will get a lot out of this. So good evening, everyone. I wanted to speak a little bit tonight about examining health professions careers. The activity that you just participated in is extremely helpful because that guides myself as well as our panelists tonight on helping give you the information that you need. And I always think that is really important because capturing what you need is helpful for us. How do you know you want to go into the health professions? And I think this is a good question for all of us because sometimes we get so focused on getting in or getting right to maybe being accepted that we lose focus of really why do we want to do that. And for the health professions, the reason why I think that this is even more so important is because of the time and the cost. And so in our office, if you've not been in, you'll know after coming in that we really thrive on 3 verbs in our office. And one of those is explore, which I think is the biggest part of what I want students or what we want students to do. The other 2 we'll somewhat talk about today. The second one is prepare, and exploring and preparing go together. And then the third that we use is apply. So explore, prepare, and apply. The apply piece is usually down the road. Once you've explored, you prepared, you know this is right for you. And then the next part is applying, getting letters of recommendation, that type of thing. But for this evening, we're going to talk about the exploring and the preparation because I think that's really significant. It usually takes a little bit longer of a process to do that. So I always encourage students to shadow. If you haven't, this is a great time that you can pick somebody that you think you might want to walk in their shoes someday, and you can follow them in their position. From every experience that you have, whether it's shadowing or volunteering, or maybe a paid part-time job, I always encourage students to reflect on those experiences. So, you know, again, thinking about your day, your experience, maybe journaling. What do you like about this? What don't you like about this career? Because when you find something that's right for you, there's an adage that you really don't work a day in your life. And that's really, truly important to find something that interests you, that excites you. And as I've shared before, these are not jobs, they're this issue. And so take advantage of the opportunities and resources that are available for you now, and just know that other people just like you are in the same situation.
So I actually wanted to do medicine too, like most people. But with my grades, I'm being quite frank with you, I just decided, okay, well, I still want to be in the medical healthcare realm, and what can I do? So I, looked into it, and nursing is just so vast with like what you could be. Like you can just start as a bedside nurse, but the higher degrees that nursing has now is, you can grow into any specialty you want to be in, any like location you want to be in healthcare. So I'm a bedside nurse now, but there's, CRNA if you want to be an anesthesiologist. There's, an NP if you want to be a provider. There's NPs in acute care, there's NPs in family practice, and you can even be Botox if you want. So I found a lot of job security, and I really wanted to be in the medical field, and I knew I wanted to be in the ICU. So nursing just caught.
Back when I was an undergrad, I know there are programs like clinical care extenders and those types of things. I don't know if those exist or if they still exist during this time. But I think starting off with the advising center first might be like the best way to utilize your time and resources, because it's great if we weren't in a pandemic and without all these restrictions to reach out, because it shows that you're proactive. But I think if your advising center knows that some places actually accept volunteers, that might save you some time and some headache. So yes, it is a difficult time, and I think both in the emergency room and the ICU and just nursing in general. Like I think we as emergency physicians, especially, we can't thank our nursing colleagues enough, just because they work very, very hard. I mean, I know physicians work hard, but they work hard. The way I personally kind of deal with it is kind of trying to reframe my focus. I realize the fact that we're kind of all in this together, specifically like healthcare providers. Like the nurses are in the pit just as much as the physicians are in the pit, just as much as the housekeeping staff, ancillary staff. But I think when we circle back around and we realize why we're doing this, even though it's hard, we're realizing that there's a bigger reason as to why. Like we're trying to help this patient.
Nothing that's really going to get you ready for medical school. You kind of just get thrown into the fire. So, there's nothing to do. People, you like to say, oh, I'm going to self-study, pre-study stuff. Don't. I think when it comes to a gap year, your main priority should be to kind of look at what's weak in your application and use that gap year to boost it. And people don't realize that after you apply, if you're taking a gap year, you have time to update schools on what you're doing during that gap year. So they'll see all that. And if there's a weakness in your app and you're addressing it during your gap year, they're going to know that. And that's going to be important. So use it to your advantage, do something productive. It's not a time to just kind of chill and like relax and go party and go to all these raves and stuff. Use it to your advantage.
Medical school, you can decide in terms of like, oh, do you know or not if you want to like even pursue medicine. I think that's really up to you. I think a good way to just explore that is to shadow a physician and see if that's something you could see yourself doing, or talking to the physician, asking about their lifestyle. Because it doesn't, really, whether you're a radiologist, dermatologist, emergency medicine, it's every single physician put in time to become a doctor. Realistically, like I'm in my 20s, I'm going to be studying. Well, a lot of my friends are not necessarily studying all the time. Like they have jobs. It's like having an interest in something, and then a lot of my activities revolved around that. So I was really interested in women's health at UCR, and so I promoted women's health in my job as an RA. I helped install like a women's health vending machine at the school gym. I had different leaderships working with ASUCR, and then I promoted women's health through stuff with them. And so I was able to talk about it a lot and write about it in my application. And I think that's what made me get an interview. And then in my interview, I spoke about it even more.
First sight, when I rotated through, I didn't think I was going to be an orthopedic surgeon before medical school, but just to look back on my past, I did take metal shop in high school. So I was always sort of mechanically inclined. And I just love the fact that you could see something and fix it and make people better. It was just really fun to do. So that's how I ended up there. I think I was born to be an orthopedic surgeon. So at least the etiquette for my office, and we have scribes, we have a lot of pre-PA and pre-nursing, pre-students. The best thing is to ask the questions when the patient's not there. Like you don't want to interrupt in the middle unless it's a different focus, but at least in our office and the other physicians are the same way. It's kind of like when the doctor's seeing the patient, that's sort of the patient's time, but then afterwards is the time for the students to ask questions.
Private practice, where you have your own office, you're working in the office mainly, that there's a lot more flexibility. You have a lot more autonomy with your schedule. So you can balance being at work, being at home. Hospital work, often it's longer hours. You're kind of on, you don't really have your own schedule at the hospital or the patients in the hospitals. So for me, that was a big motivating factor that, I wanted to end up in California. So I was very focused in med school to try to do well so that when it came down to residency, then I could apply and hopefully get a spot in California. So, while I was there, I was just very focused, met a lot of people, had a lot of fun, studied a lot.